Welcome, everyone. My name is Paul Erwin. I'm the Dean of the School of Public Health here at UAB, and I'm excited to welcome you today to this career conversation with alum Dr. Heather White. Today's webinar is made possible by the Office of Public Health Practice, the Public Health Student Association, and the Sparkman Center for Global Health. Each sponsor is offering virtual events throughout the semester. Check out their websites and social media for updates. And so now let me introduce our guest. Dr. Heather White is a global health specialist with 20 years experience in program design, management, and evaluation across numerous practice areas, including non-communicable diseases, family planning, HIV, and cervical cancer prevention. She has experience in both academia and in the nonprofit sector. Heather currently serves as the executive director at Together for Health, a global advocacy organization dedicated to ending preventable deaths from cervical cancer. In this role, she works with a global network of partners to highlight the urgent need for resources, favorable policies, and aligning program strategies with global best practices, and sharing stories of women, families, and communities affected by this disease. Prior to joining Together for Health, Heather served as the Global Technical Advisor for Non-Communicable Diseases, I can't say that word, at Population Services International and at the University of Alabama for 10 years, holding positions in the School of Public Health and in the Sparkman Center for Global Health. She holds a doctorate of public health from the University of Alabama, Birmingham School of Public Health, and is fluent in French. When she's not working, Heather enjoys cooking, spending time with her family, and being outdoors. Heather, welcome home. Welcome back to the School of Public Health.
Oh, thank you so much, Dean Erwin. What a pleasure it is to be invited to speak to you all today and to share perhaps some insights and a bit of wisdom that I've learned along the way. I appreciate the opportunity very much.
Great. Well, you heard my introduction. Let me invite you to fill in a little bit more about yourself, where you work, and what you do.
Sure, I'm happy to share a bit about what we do. So as you rightly said, I am the executive director of a nonprofit called Together for Health. And we are a global advocacy organization that is meant to we focus solely on cervical cancer prevention, really highlighting the inequities of the disease. If you look across the globe, 90% of the women who die from cervical cancer are in low and middle income countries. So it's really for us very much a disease of inequity and a social justice issue. So we bring that attention to this disease area. We also work with an extensive network of implementing partners. These would be large NGOs that are on the ground, that have infrastructure in place and work across the developing world to usually in reproductive health and in women's health already. And so we work with them to understand how to best layer on these services, that is HPV vaccination for girls, and a screening for women, and preventive treatment or further treatment for those women who need it. So we align ourselves with really the organizations that we know are doing the work on the ground to really culminate best practice. And thirdly, we work to share the stories of the women and the families and the communities affected by the disease, because we know that, connecting at a personal level about how this disease, affects women across the globe can really spark and ignite compassion and empathy and make people, want to do more about it. I recently heard from Dr. Grossbeck-Parham, whom you all will know also as a UAB medical school graduate and one of our former professors. Dr. Parham is actually the medical director for the WHO elimination campaign for cervical cancer these days. And I recently watched him on a webinar where he said, you know, for every woman who dies of cervical cancer, that directly affects 16 people in her family, in her community. 16 people count on that one person every day. And so you think about those ripple effects. So one of the things we try to do at Together for Health is make that connection for people, really understand that, yes, it is about good public health policy and good public health practice, but at the end of the day, it is about people finding ways to help each other in these communities. So
fantastic. That's quite a statistic. One woman, 16 people.
yeah.
And you think of the circles out beyond even that 16,
Mm-hmm.
all from what is, for the most part, an entirely preventable disease. So, Heather, tell us a little bit about your career path after you received your MPH and DrPH in international health. You got your MPH in 2001. You worked here at the school for several years, and then your DrPH in 2011. And then you've been doing many different things since then. So, what's a history?
Yeah, that's right. So I became aware of public health as a career opportunity and as an academic opportunity just as after I had graduated, actually also from UAB. And I knew at the time, I had sort of this epiphany moment sitting in a waiting room at the student center at UAB. I was a tutor. I was a French tutor for UAB undergrads at the time, and I was waiting for somebody to come for our tutoring session. And I remember very clearly pulling a book out of like a career center, and it was all about the Peace Corps. And I remember starting to read these stories about the Peace Corps and these volunteers and what they were doing. And I thought, yep, that's for me. So I knew that Peace Corps was going to be sort of the venue or, you know, my path. I knew I wanted to do that, but I wasn't yet sure, you know, in what way would it be impactful. So when I met a woman who at the time was leading the Peace Corps group, her name was Erwin Brannigan at the UAB School of Public Health. And Erwin said, you know, Peace Corps does this really cool program where you can couple your master's training with your Peace Corps service. And it was called Masters International. And so I, you know, ran to my nearest computer to put all the paperwork together to put that in place. And so I did my public health coursework, and then I left in June of 2000 to do my Peace Corps service, which was in Burkina Faso, West Africa. And yes, I had no idea where Burkina Faso was when they called me to tell me where I was going. I was so excited, and they said Burkina Faso, and I was like, where is that? And I considered myself to be relatively geographically, you know, competent, but in any case, so Burkina became my home for 2 years, and it's really the place where I would say I figured out that for me, public health and global health was something that I wanted to do, that I was good at, that I felt like my batteries were sort of recharged in those moments. I mean, they weren't without struggles or challenge, but I liked being with people and figuring out, you know, problems that were happening in the community and ways that we could solve them together. And the Peace Corps ethos was very much about not being somebody who comes in with sort of preconceived notions or ideas, but to sit down and talk to people and come up with solutions that could work for that particular setting, for that particular community. And that has really been a lesson that comes back to me time and time again. You know, no matter where in the world we're thinking about a project or an idea, even if I think I've got the best idea in my mind, I usually am quiet for, the majority of the time working, because it's not about my great idea. It's really about finding solutions in local communities. So in any case, I came back to UAB and to Birmingham after my Peace Corps days of 2 years in the Peace Corps. I think I sat on the couch for a week in the air conditioning and ate pizza. That was priority number one at the time. And then I was fortunate enough to, there was a job in the School of Public Health with Dr. Sten Vermund, if folks are around who would know and remember Dr. Vermund. And at the time, he was building out his research capacity and infrastructure in Zambia at the Center for Infectious Disease Research. And so I took on a job under his direction as a program manager, building out the clinical trial capacity for HIV prevention trials in Zambia, which was really another very informative experience to me about the importance of building relationships and building trust in not only in the communities that you serve, but also among the people that are the decision makers and the folks who are running and expected to sort of build each of the components of this work. So I remember what I appreciated so much about Stan at the time is that he had a Fogarty grant where he could bring people to UAB for their lab training and their epi training. And these were already leaders in their respective fields and in their communities, and they would go back. And Sten really relied on their expertise, their knowledge, their skills. He was consummate, I think, as sort of leading from behind, which is, again, I think something that really speaks to the value of our field. You've got tools. You've got ways that you can help solutions come to the fore, but it really is about problem solving in local communities and contexts and helping people find the right solutions for themselves. So my UAB career was about 10 years long. I worked first with Dr. Vermund, and then I was fortunate enough to work with Dr. Craig Wilson, who took over the director position at the Sparkman Center for Global Health. We together started to build out the certificate programs for global health at Sparkman that were just starting to come together at the time. And that was a really exciting opportunity to be able to think about, what are the skills that are required of these young professionals. And so I learned to really appreciate the competencies that you build early on and how you take them into a career path. From there, I have to say, research and the academic space was feeling a little too slow for my sort of impatient self. I realized, from start to finish, even a small clinical trial could be years in the making, and certainly years in the making of the final publications. And it felt like the pace for me was a bit too slow. So I decided to get into the nonprofit space. So I called upon my Peace Corps friends and said, hey, for those of you working in DC that know global nonprofits, let me know if anything comes up. And literally the very next day, somebody sent me a job application, which I was either foolish enough or smart enough to apply to, but it was a professional grant writing role. So I stepped into the nonprofit world as in the development space and writing grants for a living, which is a tough gig, but you learn a lot. So, and then I took on a technical role as a technical advisor, really because of my DrPH work, because I had looked at in my dissertation trying to understand women's conceptualization of cervical cancer and of cancer itself. And among Zambian women, where did screening fall as a priority for them? Was it a priority? Really trying to understand from the patient or the client perspective, what did it even mean to be considering or be thinking about preventive health and screening and so forth.
Wow, what an incredible journey you've been on. taking you to a lot of different places around the world. And now you're at Together, and you described a little bit about some of this work. What's a typical day look like for you, and how has COVID impacted that?
Yeah, great question. Well, I would say since my PSI days,
PSI is?
Oh, sorry, since working for Population Services International, PSI. And I'll quickly say PSI is a global nonprofit that traditionally works in family planning and reproductive health, which made an easy entree into the cervical cancer prevention space. And so in that role, I was leading the technical work for non-communicable diseases, which actually was hypertension, diabetes, and cervical cancer. And we could debate why cervical cancer ended up in the NCD portfolio. But in that role, I was supporting somewhere in the order of 15 different countries and their programming in each of those health areas. And so that was, a lot of program design, program evaluation, making sure that all of the administrative reports are met, the donor, conversations were happening, doing grant writing work, et cetera. Moving to Together for Health, which is a much smaller organization. We're a mighty team of 5 people. It is a different framing in that, we're not doing the work ourselves. We're not out there implementing and executing on the ground every day, but we are talking across all of the players that do. So where we see, adding value is really about having the conversations on the Hill, for example, doing advocacy work on the Hill, while the folks who are implementing and doing the day-to-day work continue to do that well. So for me, a typical day would be logging on to my trusty laptop at around 8 in the morning. I'm usually talking to folks in Kenya. We've had a communications campaign we've run in Kenya this year. We're building one out now in India. So starting to put together kind of the broad brushstrokes around that work. So I'm usually on the phone with, country X, Y, or Z for a couple of hours, and then spend the afternoon talking with our team or with our implementing partners. So lots of phone time, lots of Zoom time. COVID hasn't really changed my life in that sense. I've worked remotely for 7 years now, the past 7 years. So, for better or for worse, I suppose I'm one of those folks who figured out how to make working from home work for me. But I do know it's certainly a challenge to get used to. That's for sure.
Have you been able to travel internationally?
Yeah, good question. So I have not traveled internationally. There are talks of perhaps traveling, but from my NGO colleagues who are the real road warriors, who are probably typically in the air, in the field 50% of the time or more. What I've heard from most of them is that things will probably reduce about, half. They will take half the number of trips as they normally would. And I have to say, actually, one of the things that I do think COVID has changed is to make everyone realize, wow, I can get much more done sitting in my own corner of the world. And even in the development space over the past 20 years that I've been in, I would say that there is much more of a space of local expertise. These are individuals who have perhaps gone elsewhere, gone abroad for education and come back to their country of origin, or there is simply more expertise in all of the countries where we work, so that it's not necessary for someone like me to get on a plane, and certainly not to design or to solve problems. I might be troubleshooting, or if something is really sort of imploding, I might be able to lend a hand. But I would say that I'm becoming more and more of an outlier in the sense that I don't need to fly in all the time for for technical work or technical support. I could usually do it, right here in the comfort of my office.
Yeah, and I guess that's one thing that COVID, as much as anything else, has forced us to do in some ways, and maybe one of those silver linings in terms of our ability to connect and reach across vast distances while working, as you said, from the comfort of our own homes. So you mentioned the work that you were doing here at UAB when you were in the halls of academia, and then the work that you've been doing in the nonprofit world. How do those two worlds differ? What do students need to understand about that difference, even as they're still preparing for that next stage of their careers and lives?
Yeah, that's a great question, and I think for me as an individual looking back on my career so far, I can very clearly make a break between the academic world and the nonprofit world. In an academic environment, I think it's great to be in those arenas because you understand, obviously the pillars of science and scientific thought. From a public health perspective, you certainly learn about research design for those of you who are either taking EPI or majoring, focusing in on that. You learn all of those pieces, and they're quite important. I mean, there is COVID, I suppose, has taught us or reignited that value of scientific discipline over and over again. But there is, of course, a world that sits outside of the research domain, and that tends to be the nonprofit space. I mean, I can say at Population Service International, where I was for many years, now there's a research team. They're going to help you design, whether you're doing implementation science or you're doing other types of research inquiry, that all still exists, but there's an entire world of practice and of programming that sits outside of a research domain. And those are different skill sets and different ways of looking at not only, having a research hypothesis and testing it in a formal setting, but thinking about how does that then translate into practice and into integrated into ongoing programs. So I was very much interested in understanding the nonprofit space and being a part of that space. And I will say it moves very quickly. It is just a different way of sort of deconstructing and putting programs in place.
Fantastic. Let's drop back again to the time when you were here at UAB. And as a student, not in the time when you were here working, but in the time that you were here as a student, what kinds of student experiences do you recall that really made an impression on you that helped shape your decisions about what next in your career path?
Yeah, that's a great question. Well, for me, sitting in the classroom and learning from, many of those public health professionals who were concurrently, working in communities, understanding the importance of building relationships in those communities, and doing that work day in and day out. I appreciated and learned from people who had figured out how to take sort of public health as a discipline and make it come alive in their work. I mean, I am always a big proponent of, case study courses and courses where, yes, you have to have sort of the knowledge and the framing of thought, but like, what does it mean in practice? What does it really mean to start to build out and build a program in the public health space? So for me, the most interesting courses were always going to be the ones that were practice oriented and that were about taking the skill sets and then putting them to use and understanding sort of real world dilemmas, which I think, again, COVID has given us plenty of food for thought about, this is literally unfolding in front of our eyes. How do we convince people, day in and day out, and not take for granted the science, the messaging, and how to keep public health practices moving forward, knowing that it is a challenging environment that we live in.
So why don't we go to some of the questions that have come up in the Q&A box there. Can you elaborate on your experience as a program coordinator?
Sure, I can. Yeah. So I was first working with Dr. Vermund again. At the time, he had a Fogarty International grant to bring promising researchers and scientists from developing countries to the U.S. I want to say that we had programs going with Uganda, with Mali, and with India. And the idea was that they would come to the U.S. and my job was really to host them, and to make sure that they were, comfortable in their academic pursuits, that they sort of knew the what to do academically, but also sort of how to manage life in the U.S. I can remember more than one trip to Walmart, and I remember one time this wonderful man, Dennis O'Talley, who's from Uganda, and we were walking through one of the aisles at Walmart. And I said, Dennis, you're going to want to grab an iron and an ironing board. Well, his jaw could have fallen on the floor. He was like, what? I said, of course. Yeah. So literally teaching these these bright scholars the importance of ironing a shirt, and so those are the sort of fun things that you're doing behind the scenes to coordinate these larger programs, and at the end of it to see, people go through training that is top-notch, world-class training, and then go back to their countries, to their home countries, and put that training in place is such a gratifying experience, and knowing that ironically you're doing it yourself, but just in the opposite direction.
Yeah, exactly.
Yeah.
Thank you for that. Another question, what would you say are the most appreciated competencies and skills in students aspiring to work in global health?
Yeah, great question. So again, my bias, I suppose, is always towards practice. And when I think of practice, soup to nuts, I'm first thinking of what is, number one, clearly identifying a problem that you want to solve. What are your assets around that problem? What are your deficiencies around that problem? Who do you need to help solve the problem? And then to start to build out, a theory of change, a logical framework. What are your indicators? How will you measure your success, et cetera? So it's really the nuts and bolts of, I suppose, program design and program thinking. And I know that in UAB's curriculum, you probably get exposed to many different facets of that work. And I would say to any student who is interested in any particular competency, who's ever teaching that course will likely have real world experience. So don't be afraid to ask questions, to learn more, and to have a real appetite for curiosity around not only the skills, but what is it that are maybe not the obvious skills, but the softer skills, the sort of emotional intelligence side of things that allow people to be competent and to be, leaders in their respective fields. To me, it's really important to, if you find somebody who lights a spark for you, whether they are a professor or whether they are a colleague or whatever, however they end up in front of your path, don't be afraid to ask them, how did you get where you are? How do you do what you do? Because we all want to make a difference. We all want to contribute, and people are usually, I've found, very willing to share their own stories and their own ideas of success.
Yeah. Well, Heather, a related question to this one is breaking into that space, especially breaking into the global health, the international health space. What do you recommend to students in terms of how to break into that space?
Yeah, that's a great question. And it's not always easy to figure out. So in my mind, a program like the Peace Corps is still, Peace Corps is not without, its challenges, but it is still, to me, the best way to really get a feel for whether you would want to do the work long-term or not. Peace Corps is a 2-year commitment, but I'm quite sure that there are other types of internships or experiential programs that allow you to be immersed in whatever setting that might be and really understand the day-to-day challenges of the work. And not only the professional side of the work, but sometimes even the cultural dynamics are more than people can bear or want to. And so it's really good to immerse yourself in another environment to say, is this something that I would really want to do long term? Interestingly, I just had a conversation with a colleague who said, for me, I didn't want to be sitting at the sort of headquarters level of a global institution and only be deployed in the field every few months or, at intervals. He said that wasn't enough for me. I really needed to be in the community. I wanted to be with the people every day. And so, the type of job that would put you at a headquarters level only to be sent out now and again didn't work for him. And I think for everybody, global health offers a lot of opportunities, and there are a lot of different career paths there. And you just have to figure out what works for you. And you can only figure that out by being willing to be vulnerable and take chances and try to get as many experiences under your belt as you can. I'm always struck by, young people coming out of an undergraduate or a graduate career, and they feel so polished. They feel like they've got it all figured out. Well, let me tell you, it is a facade. Don't buy into it. You don't have to have it all figured out. Please try things. If they don't work, try something else, but give yourself the benefit of having those experiences, because it's only by virtue of those experiences that you can learn, this doesn't work for me at all, or yeah, I could do this. It's the experiences themselves. And maybe, I hope I'm not going on too long, Dr. Erwin, but to quickly say, how do you get the experience? How literally do you break into things? I would just offer the advice to say, again, setting up informational interviews with people who are working in these organizations. If it's a nonprofit that you want to go into, don't be shy about reaching out. I can say in my own professional course, if somebody comes to me, if somebody gets my name and emails me, I'll do everything that I can to help give them the right, perspective and opportunities that come my way. And I think everybody in our field has a generous spirit like that. Maybe not every single person, but I want to say that public health, we're charged with ensuring the health of the public. We are do-gooders at heart. We want to do good things, and that includes wanting to see, people at the beginning of their careers give opportunities and allow for experiences. I will say this, the DC-based NGOs, the large nonprofits, the Beltway Bandits, as some people like to call, they're really competitive and they're hard to get into. But if you can get your foot in the door, I always tell people to go above and beyond to the extent that you can. Make yourself visible, ask questions, and you'll stand out. People will recognize you as being, hardworking and enthusiastic. And I think those are huge assets in the beginning of a career.
Yeah. I'm so glad that you mentioned again Peace Corps as a way that served as a springboard for you, because as you mentioned earlier, when you made the decision to move from academia to nonprofit, you called up your Peace Corps friends, and that creates a network that's incredibly rich and can provide opportunities. I think of other opportunities that students might think about, particularly for our undergraduate students, the Fulbright Scholars Program, which again puts you in an international setting for a year, not 2 years, and it may or may not be directly about health. But it provides you with an opportunity to, as Dr. White said, immerse yourself in the culture. I would also, and again, you sort of alluded to this, I would also encourage students connect with faculty who have had those experiences themselves, and particularly connect with our international faculty, who may very well be able to provide an open door for you to their country of origin. So that is something else to think about. We have a couple of more questions in the question box that I'll throw your way, Dr. White. Have there been specific challenges, especially in light of the pandemic, where continuing to make strides toward your organization's mission have been limited due to funding sources?
Yes. Yes, yes, and yes.
Yes.
I actually took over the executive director role Together in July of last year, and the pandemic was certainly happening. But we were trying, as I suppose everyone was, to read the tea leaves to try to understand, what does this mean for our organizational mission? What does it mean for the cervical cancer space in general? And in some ways, we were just putting together this past week, every year we do a global funding report where we're looking at, across a spectrum of donors, how much money is being put into this space and how and what's happening with those funds. And so we were really anticipating that 2020 we'd sort of fall off the cliff. And I was really happy to see that the numbers were, definite reductions in the amount of dollars spent, and therefore the impact around, vaccine screening and preventive treatment. But we did not, it was not as bad as I had anticipated. So, we're small enough Together to be nimble, to be able to sort of reorient ourselves. But we certainly did do a lot of fundraising to help the programs get back on after COVID. Sort of what do we need to do to re-inject the right resources in the right places to, for example, reignite HPV campaigns that might have paused with school closings and things of that nature. So we went back to the drawing board to figure out how could we support our program partners in sort of recalibrating and figuring out what they needed to do differently And surprisingly, I would say, many of our partners have come back to us and said, although it was a challenging year, we were forced to become much more efficient in our operations. We were forced to figure out new and creative ways to reach girls and women. And so I think there have been a lot of programmatic lessons learned that people will continue to take forward. So I suppose that's the upside of a global pandemic. It forces you to think in new and different ways about your work.
Well, in fact, one of the questions that just came to mind as I heard this response, Heather, is that in the midst of the pandemic, one of the things that we've been experiencing as a population is vaccine hesitancy. And I'm wondering if you've seen an overlap regarding HPV vaccine issues. Are you seeing some overlap there?
Yeah, it's a great question. And of course, any of you who've worked in global public health will know that the expanded program on immunizations, the EPI programs, are typically the public health rock stars of many of those countries in terms of coverage rates. They're high, they've always been high. And so in many ways, I feel like they could teach us a lot about how to increase coverage rates for HPV vaccine. We haven't seen vaccine hesitancy for the under 5 vaccines or even for HPV yet that I'm aware of. But I think what is one of the challenges in the HPV vaccine space is that we actually have more demand than we have supply. So there's a real supply issue with respect, and that is a function of having too few manufacturers. Of course, there's only been 2 global manufacturers to date, but that's starting to change. There's just been an Indian company that has gone through WHO pre-qualification for vaccine, and they are coming online right away, as well as a Brazilian company. And so I think the more that we start to see technologies and investments made on the supply side, we'll actually start to see that balance out. At least that's my hope. But I'm happy to report that of the programs that we've talked to, vaccine hesitancy for HPV vaccine, although it's sort of always a background issue, coupled with the fact, coupled with messaging of HPV as an STI, it's always a challenge. But I don't think COVID vaccine hesitancy has impacted it too greatly at this point, which is good news.
Heather, we've got a couple of questions about cultural challenges, cultural humility when working in the global health areas. Have you experienced cultural challenges in implementing programs for Together? And how do you address those, especially in the current setting where your work is primarily physically here in Birmingham? Yeah,
it's a great question. And again, I think my bias, the reason that I know that I'm a lifelong public health practitioner is because I really do see the relationship building as the crux of our work. We are tasked with developing empathy, understanding problems of the other, and so I hope, I always try to approach my work, particularly in a different context or different country that is not my own, as an opportunity to learn, an opportunity to, as my mom would say, keep my mouth shut and my ears open, but really to be learning and listening as much as I can. And, sure, you have experience and you have tools as a public health practitioner that can help people, again, get to the problem they want to solve or the challenge that they need to overcome in a quicker way, in a more structured way. But when it comes to cultural dynamics, I suppose I will forever be a Peace Corps volunteer, also in the sentiment that I want to learn from you. I want to hear what you have to say. I am I'm not the expert. I don't want to play the role of an expert. I want to play the role of a human being who happens to be sitting beside you and figuring out what we need to figure out together.
Wonderful communitarian perspective. Thank you.
I suppose.
It's very, very refreshing to hear in this edge of the pandemic that we're still in. A couple of practical questions, if I could. Why did you choose to pursue a DrPH instead of a PhD?
Yeah. Well, when I was looking at both programs, it was explained to me that a DrPH was very much a mid-career practical degree, which spoke to me. I'd had about 10 years of experience following my Peace Corps days, and I wanted to keep, I wasn't interested in, sitting out to get a PhD for the sake of getting a PhD. I wanted to sharpen the tools in my toolbox, what I'd already learned. I wanted practical knowledge, and I wanted to get back to work or continue working. And for me, a DrPH was the right amount of time, the right opportunity in terms of coursework and augmenting my skills. And it felt like the best fit for me.
The practical application of what you learned in the classroom.
That's right. That's right. Yeah.
And speaking of what you learned in the classroom, when you think back to your time, even going back to your MPH, but certainly your DrPH and the subsequent work that you did, is there something that in retrospect you wished you had spent more time studying, or a course that you wish that you could have taken that would have helped you along your path?
Yeah, it's a good question. Well, I can say, so for me, I did a concentration in monitoring evaluation. And at the time, Dr. Chen was leading that program, and he had such fantastic advice, very practically oriented again. I mean, the theory and knowledge was certainly there and was the foundation, but a very practical orientation. And I always and continue to sort of thirst for the courses that are going to be about case studies, that are going to be about, analyzing perhaps in hindsight what we could have done differently, what we could have done better, et cetera, when it comes to public health challenges and the way things are helped. I suppose if it's not happening already, which I know it is, reflections on COVID and the decision-making processes that are happening literally every day is the kind of course that I would always gravitate towards. I don't think that there was anything that I feel like I missed, although I will say the course where you learn how to do statistical analysis by hand is it really, and forgive me for not remembering the name of it, I'm sure I've blocked it out, but that is a really useful and important course to start to build out, because the functions of technology, of course, and drop-down menus and making things user-friendly will keep getting better. But knowing the sort of back-end part of it, what are the algorithms really representing is such a fundamental piece of a graduate program of learning, I would say.
Fantastic. I want to ask a question about transferability. And what I mean by that is, you've been working in the global health arena for much of your career. And yet we know there are challenges in rural areas, particularly in Alabama.
Yep.
And challenges with a very focus of your work, challenges in cervical cancer screening and other prevention efforts such as vaccine availability. How transferable is what you're learning and applying in global health settings is transferable here in Alabama?
Oh, it's a great question, actually. And it's funny you ask, because taking on the leadership role at Together this past year, I work closely with a woman who co-founded the organization. She's our chief strategist these days, but she and I are really sort of putting together a lot of the design and strategy and thinking around our work. And I said to her, look, I don't feel really comfortable, working for the benefit of countries across the globe when I know rates of cervical cancer in Alabama are among the highest in the country. Could we think about maybe doing work here? And it's actually, we've been talking to Dr. Isabel Skorinsky now for several months, and have a project that we are hoping to launch, if not this year, by early next year, in Alabama, looking at counties of high HPV cervical cancer burden, and working to do education and linking women to screening opportunities. And so I absolutely think that the skills, which again aren't necessarily things that you learn in a classroom, but things that you probably develop over time, the skills of humility, empathy, listening, collating responses, coming up with strategies to look at problems as solutions if you flip them in the right way, if that makes sense.
Mm-hmm.
Doing those things as a group, building consensus, putting together an action plan, making people accountable for those actions, et cetera, are all skills that you probably don't find on a test in grad school, but you will learn them. You will learn them if you stick around in this career long enough, I think.
Well, Dr. White, we're coming in close to the end of our webinar time, and I want to give you an opportunity to make any additional comments. Maybe there was a question that you were thinking of that didn't get asked, but let me turn to you. There are no questions waiting for us in the question box, so I will turn to you for any final thoughts and comments.
Well, thank you. One thing I do want to say, and I'm sure that it is as true today as it has been over the course of my career, which is to say, Birmingham and Alabama may feel like sleepy little towns, but let me tell you, when it comes to our medical reputation and our public health reputation, we really are at the top of our field. So I'm always surprised when I tell people I did my dissertation work in Zambia and worked closely with the CIDERS team and worked closely with Dr. Parham. People's eyes light up. So please be aware that you actually carry great credentials with you out into the professional world. And you'll be surprised at the other UAB grads and alumni who will cross your paths if you stay in this field or you are in global public health. The only thing I would say to students is, again, have an unapologetic curiosity about your work, about life. Ask questions, because in asking questions, you can spark conversations. And when you're in the classroom, you sort of figure out the right answers right away. But real life is not about the right answers. It really is taking every problem, taking it apart, putting it back together, and solving things, community by community. So be curious, ask questions, and don't be afraid to make mistakes, because they will teach you along the way, and you'll be surprised where your mistakes can put you in life.
And unapologetic curiosity. What a wonderful place to end our conversation. Dr. Heather White, thank you so much. What you just talked about in terms of the reputation of the School of Public Health is heightened by having graduates such as you. And so we thank you for what you're doing, for what you represent and for who you represent, and your pursuit of equity and social justice in the work that you're doing. So thank you very much for your time, for your work, and let's stay in touch.
That sounds great. Thank you so much.
Thank you.
Mm.
To our audience, we thank you for joining us for this career conversation, and we will look forward to seeing you again for future career conversations that will make sure that get announced through our Get a Handle newsletter and other venues. So again, thank you to the Office of Public Health Practice, to the Student Public Health Association, and to the Sparkman Center for Global Health for sponsoring today's career conversation. Thank you very much.